Hi, welcome. My name is Cynthia Price, and I'm here to present how yoga can benefit Parkinson's disease. So I'm going to pull up and share the screen, so bear with me, touching buttons. Already it's my secret. Okay, so let's see. Okay, so I have titled this Parkinson's disease is complex and yoga can help. All right, so where do I want to begin? I want to begin with my introduction. So again, my name is Cynthia Price, and I've been a yoga teacher for over 2 decades, probably closer to 3 decades now. And that my road has taken me into becoming a yoga therapist. I will be certified in a couple of weeks as I've been through a certified program. And what do I like about becoming a yoga therapist? So for me, becoming a yoga therapist has finally had the missing piece for me, which is science, evidence-based proof that yoga can help. All right, so to give you just a little more background, I have been in yoga my entire life. My mother was the town's yoga teacher in Highland Park, New Jersey. So as much as I tried to run away and find a different path, all roads lead to Rome, back to my home of yoga. All right, so that being said, I care deeply about yoga and also now deeply about Parkinson's disease. Okay, so when I first started teaching Parkinson's yoga classes, now that's maybe about 4 years now, I didn't have all of the science, but what I did have was skills with yoga that that apply to regulating the nervous system. So if you're a yoga teacher or yoga therapist, really my heart is in this, and that this presentation is for everybody to pick up a tool of yoga to bring ourselves in a place of well-being and basically peace in life. Okay, so Parkinson's disease. Let's start with this first slide. This side is very simple, and it says a lot to me because it says that Parkinson's disease starts deep in that primal brain, right, in that basal ganglia. And what happens is that we lose the ability to make dopamine. Those cells get destroyed. So as I come through the rest of this presentation, you will see a lot of words. I love words, but I'm not going to go through everything because if you have the chance to come back and maybe read some of the research if you're interested, the hubs and the links are here for you. Okay, so let's begin. What is yoga? All right, so the basic of yoga means to unite, basically to join together the body, mind, and spirit. It's a popular exercise, right? So Hatha Yoga, which is what we're going to be discussing today, combines physical postures to address strength, flexibility, balance, that mind-body connection. It uses breathing practices and meditation also to deepen that greater sense of self-awareness. And you're going to hear a lot about awareness as we move through the presentation. And I just want us to say here that some of the studies have suggested that yoga can produce great benefits in ameliorating both motor and non-motor symptoms of PD. Yoga does not adhere to any particular religion, belief system, or community. It has always been approached as a technology for inner well-being. Okay, and all right, so let's go over just briefly what is Parkinson's for those who are new to this. Parkinson's is a progressive chronic neurodegenerative disorder. It's associated with a damage or loss to the dopamine-producing cells. I talked about that earlier. And when the dopamine chemical that regulates your body movement is lessened, you have less mobility and less control over your movements. All right, so Parkinson's disease is classified as a movement disorder. What I like about PD is that everybody is special. It is an extremely diverse disorder. No two people with Parkinson's have the same symptoms or progression of the disease in the exact same way. Okay, this is what is keeping us in this place of how do we find the cause, or how do we deal with Parkinson's? So the medical side comes through this place of regulating the symptoms, and yoga pulls back a little bit more and tries to come in from a place of feeling good in the bodies and the beings that we have today. Okay, so back into Parkinson's disease. Not everyone with 5 or more of the motor symptoms has PD, as the symptoms appear in other diseases as well. So I'd like to say that because it's complicated. So getting the diagnosis of PD is difficult to come by, and it's also stressful, and it changes as more information comes. So here's the 5 major symptoms, and there's the classical slide that you'll see in a lot of places, is the tremor. Right, so the tremor is it's a resting tremor, not an essential tremor. There's presents with rigidity in the body, so stiffness in the limbs, the neck, and the trunk. Akinesia, which is basically the movement disorder. Posture and balance, and walking gait, which is, I'd like to call the 5th one. Okay, so PD affects the body. Musculoskeletal problems are a common cause of significant pain and physical disability in people with PD. There are estimates 40 to 85% of people with PD are experiencing pain, right? So example, frozen shoulder, low back pain, and osteoporosis. Okay, so let's just call it what it is. PD affects mostly the aging population. So let's just say over 60. There are people that do get early onsets of Parkinson's, so I'm not trying to dismiss or not acknowledge that. But I want to stay kind of in the main meat without getting too much into the details. So even here where it talks about frozen shoulder, well, frozen shoulder is not specific to Parkinson's. It just happens to be that it shows up in Parkinson's as low back pain and osteoporosis. Okay. PD affects the body, right? So what parts of the body does it affect? It affects our bones, the joint problems, decreased mobility, abnormal posture, postural instability, and falls are frequently observed, right? So the risk of falling may cause both acute and chronic damage to the musculoskeletal system. So most of the pain from Parkinson's is related to the rigidity and the loss of voluntary movement. And when we lose the ability to move, it creates that reduced quality of life. So there is this place where I want to start already talking about how the mind and the body and our spirit or wellness, harmony in life get affected, and how each one of those pieces starts to talk and erode from that quality of life. Okay, PD affects our mental and emotional health. So some people with Parkinson's disease experience mild cognitive impairment. So that could be memory loss, difficulty multitasking, or problems concentrating. And this is the most important part for me. The same brain changes that lead to motor symptoms can also result in slowness in memory, thinking, feelings of distraction or disorganization, difficulty planning and accomplishing tasks, right? But also, these same changes affect the depression, anxiety, and that they are the results of pathological neurobiology processes related to the changes in the dopamine level. So there is this place of you're not doing anything wrong. It's because of the changes in your brain that bring on some of these mental and emotional changes. Okay, so not everyone with PD experiences symptoms of cognitive impairment. And forgive me for people that are new for me. My brain goes pretty quickly when I get excited over all this information. So I'm going to try to see if I can slow it down a little bit. Okay, so depression and anxiety with Parkinson's are linked to rumination and avoidance behaviors. Life stress, so simply getting that diagnosis and living with Parkinson's daily is stressful. There's the emotional relationship strains of that. Fear of falling. Medications also can cause some mental and emotional health issues. Sleep disruptions, apathy, fatigue, and age. All right, so I think I already said something about the changes in the brain relate to that. Non-motor difficulties can be more challenging for both the individuals and the caregiver. So not only are you dealing with the physical aspects of Parkinson's, it's the quality of life, right? So the major contributors to the perception of the quality of life are apathy, decreased interest in activities and socializing. People with PD can be exposed to stigmatizing attitudes and interactions, which could contribute to feelings of restrictions, feelings of shame, and isolation, right? So that's one of the reasons I really love teaching yoga class in person. I also teach on Zoom to have this creating a community where we belong to each other, we're of like minds, and have are going through some of the same things together. Okay, and here's my favorite picture. It is the illustration of the autonomic nervous system, particularly the vagus nerve. Okay, so this is really when I get excited about this, because this is when when I first started teaching yoga to Parkinson's, I started to put together all of the symptoms and realized that it ran down the vagus nerve, and that if I could come up with modalities in every place that I could to regulate or increase the vagal tone, I could reduce some of the symptoms, motor and non-motor, of Parkinson's, right? So in brief, the autonomic nervous system dysfunction affects 70 to 80% of patients, so that's a lot. And it has proven to be one of the major roots of the disease. So for me, just looking at the picture from top to bottom, is the swallowing, the derangements of the cardiovascular regulation. So basically, that's that low blood pressure. Going down a little bit further is the gastrointestinal disorders, right? So maybe IBS-D or IBS-C, the constipation or diarrhea, and bladder abnormalities. There are sleep dysfunctions or sleep disturbances, and also sexual dysfunctions. Okay, now we're getting into the research. Lots of words, so I'm going to see if I can simplify this a little bit. Okay, I found 2 review articles, right? So let's see if I can move this down a little bit. Okay, so in these 2 review articles, the first one is by Caitlin P. Rowland, and that review article was done in 2014, and you can find the whole breakout done very nicely on that Michael J. Fox website with yoga and Parkinson's. So in hers, she went through a bunch of yoga research, and I say a bunch, but it's really very, very limited, right? And the studies are with small numbers. Okay, so hers was done in 2014, and she presents the scientific evidence pertaining to the impact of yoga on physical function and psychological well-being in PD. All right. So from hers, I just pulled out some of the three or four key points with her, and they were strength, right? So yoga is been proven to improve muscular strength in the lower body, and that helps with posture stability and walking gait. Flexibility and the range of motion. So she found some improvements in flexibility and range of motion, and they're important because Parkinson's presents with rigidity, and that limits rigidity in the joints and tension in the muscles, and that reduces their ability or the range of motion, basically for posture and walking gait. And yoga can help with the mobility of your hips, your neck, your shoulders, and let's see what else. Oh, of course, and your spine. And then mood and sleep. So the psychological benefits associated with yoga are important for the disease management, as they are not always addressed with the conventional dopaminergic therapy, right? So basically, she's talking about carbidopa and levodopa. Yoga can offer group support, improve confidence, and self-efficacy. Right? So the calming effect of yoga by enhancing the parasympathetic nervous system may lessen the perceived stress and enhance relaxation, and that would benefit also for sleep. Okay, so the second review article that I found, I liked it because it is current. It's 2021. Please forgive me if I pronounce this name wrong, by Menge Ban. And that article is titled The Effects of Yoga on Patients and Parkinson's Disease, a meta-analysis of 16 randomized control trials. Okay. So I kind of put those two articles together because they did cross over in some of the research that they reviewed. And the ones I pulled from this one are balance function. I liked the way this one was put together because it showed how small the numbers were. So remember, these are 16 randomized control trials. And of those 16, he found 7 studies, or she found, I'm not quite sure, 7 studies with only 141 patients that they evaluated the balance function of PD, right? So balance is crucial with Parkinson's, and yet the research here is still in the, I would say, the infancy stage with yoga and Parkinson's. Okay, so when they went through and they pulled the results, they showed that the yoga intervention significantly reduced postural instability. A fear of falling decreases physical activity participation, leading to further decreases in strength, flexibility, and balance. So what's that mean? It means that when you become afraid to move because you're afraid to fall, then you move it or lose it, right? So the strength and flexibility and balance that you do have starts to lessen simply by not practicing. Okay, functional mobility. So there's 5 studies, and the numbers, okay, getting a little bigger, 226. And I liked this one because it assessed the functional mobility by that tug test. And most of you have, if you have Parkinson's, have taken that timed up and go. Okay, so it's a test that you're familiar. And then the results for this one demonstrated that yoga had significant effect on improving functional mobility of PD. Mobility has an important implications for falls with PD, specifically targeted those 3 functionally important muscles again. So now we're back into the hips. This one talks about the hips, the knees, and the ankles, right? So if you think about having joint health in your hip, your knees, and your ankles is essential for balance. Okay, more research. So now we're moving into that mental and emotional category. So anxiety and depression can affect the quality of life for both the person with PD and the caregiver. Right? Mental health can worsen PD symptoms and a person's overall health conditions. The pooled results suggest a significant improvement in the yoga exercise group compared to the control group. I actually like that they use those words, yoga exercise group, because most people don't see yoga as something that they can do for simply their physical health. Now, for me, yoga is much more. It is the full 8 limbs, but really coming in where it will meet you whatever you want it to be. So yoga as exercise is excellent because we know that exercise is one of the important complementary therapy modalities for Parkinson's. Okay. Depression has a negative impact on energy levels, right? Making concentration, decision making, sleep, and perceived quality of life worse. Okay, so when you don't feel good, you don't feel like it. And so yoga will meet you where you are, right? So yoga doesn't ask you to be anything particular, or even you'll see when I teach the class later, even wearing, you wear comfortable clothing, but you don't have to be in, super gear to practice yoga. Okay, so this is the same meta-analysis, the second one, and it says, in short, yoga can improve motor symptoms, reduce emotions of anxiety and depression, increase quality of life, and promote the development of physical and mental health in PD patients. Okay, so I want you also to know that it was really difficult for them going through these reviews, which ones they would keep in, which ones they would keep out, because the protocol setting up for the studies left a little wiggle room for, you know, um, I would say wanting the results to be a certain way. Okay, so that being said, I'm going to move on to the next one, which is in that article, which was safety. And yoga is a gentle approach, right? So yoga has promise as an intervention that can be appropriate for PD patients who may not be able to participate in strenuous or intensive exercise. So we do know that exercising at increased strenuous on the cardiovascular system or intense also affect the neuroplasticity of our brains. But yoga will meet you where you are, and if you don't have the ability to do that, you can still exercise. You can still be in your body and elicit change, good change. Okay, so as you're going to see, the colors of the slide change. When you get to purple, you know it's getting to the end, but now we're in the meat of it. Now we're in the blue. Okay, so what do I like about this one? Okay, I want to talk about pain because we were talking about earlier how pain is an issue with Parkinson's disease, and it does affect the quality of life. Well, pain is complex and it is multifactorial, right? So even in cases with apparently PD unrelated pain, so in other words, there is some pain related directly to PD, and there's also some pain for non-PD, and then there's also pain related to some of the symptoms of the movement. So the movement disorder, akinesia, rigidity, depression. So again, our pain is complicated, and what I like about yoga is yoga can do the small and go right to it, but yoga can also do the broad, which is, just that overall sense of feeling good in our bodies. And so let's see. Oh, here was the most important part about this research study, which was titled Clinical Management of Parkinson's Disease, Essential and New Developments by Berman, and that was done in September of 2020, so that's relatively recent. And I like this because of the conclusion, which said, because the data regarding treatment of pain in PD is limited, treatment concepts proven valid for specific pain etiologies in other subjects should be considered. So in other words, if there is good research out there that yoga will help with a certain particular pain, let's use those tools. We don't have to wait for a Parkinson's specific research study to use the tools of yoga. Okay. So we talked about earlier that, for lower back pain, there was one for frozen shoulder, but I wanted to say that there is a recent low back pain study with Parkinson's done in 2019, and that's in the International Journal of Yoga Therapy. And this is where I was alluding to before, which is the results. This is a small study. It was done over 12 weeks. People with PD were more stable and upright, right? So it helps with posture and better transitions. To me, that's, agility, coordination. Anticipatory movements, right? So that's meaning being in the present moment with what's going on. We're more able to react quickly and appropriately to external stimuli and are better at sensory orientation, right? So those are starting to talk about the concepts of proprioception and interoception, having connection to our bodies and our beings. It says, and additionally, people with PD reported significantly less lower back pain after a yoga intervention. Okay, so I did want to list very briefly there is research, and to me this is related to that autonomic nervous system for cardiovascular health, digestion, and tremor. So the one with tremor was to me a long time ago, 2009, and it was really small, but it did give a direct pathway for PD tremor, which is one of those 5 classical symptoms, that with the relaxation guided imagery and relaxing music, patients reported improvement lasting 2 to 14 hours. So I thought that was worth mentioning, even though it was a long time ago and a small study. Okay, so now this research with mindfulness, meditation, and yoga related to Parkinson's. Finally, one with 5,000 PD patients. So this one is basically a survey, and this one was done by Fox Insight by Anouk van der Heide in January of 2021, so it's recent. Okay. So patients perceived more stressed than controls. So the control portion was 1292 out of the 5,000. And patients indicated that stress significantly worsened both motor symptoms, especially tremor, and non-motor symptoms. Right. So one of the things that was noted in the survey was that physical exercise was most frequently used to reduce stress. Concluded that PD patients experience greater levels of stress than controls, right? Well, that's no brainer. Like Parkinson's disease is stressful. And mindfulness may improve PD symptom severity with the strongest effects on anxiety and depressed mood. I thought that was really one of those meaningful, right? Look at the numbers, and that if we can reduce anxiety, reduce stress, increase mood for motivation, right? It's the ability to offer ourselves more care. Okay, meditation. So there's a one in 2018 on meditation, and it showed significant improvements in motor symptoms, so muscle strength, lower and upper extremity, balance, and muscle endurance. So here we're talking about meditation, right? So you think in meditation mind, but look at the benefits it's having in the physical body, as well as the non-motor symptoms of anxiety, depression, cognitive function, sleep disturbance, quality of life, and activities of daily living were observed. So that one was a small one with a total of 63 and 30 being in the RCT and the 33 being in the control group. All right, so here's the real kicker for me of yoga and meditation, and it has to do directly with the brain and the neurotransmitters. So yoga and meditation increase the neurotransmitters such as serotonin, GABA, dopamine that help modulate psychological disorders such as anxiety and depression. So remember when I talked in the very beginning about the brain changes that affect those mental health as well as the physical? Well, guess what? Yoga and meditation can help turn that around. Okay, so these are a lot of words to tell you about somebody. To me, was pivotal in my education, which is the research by Dr. John Kabat-Zinn. Right, he is the man. He designed that NBSR program, that mind body stress reduction program, and it's been going for over 1979, so a couple of decades now, maybe. Ooh, 4? I got a little, I can't believe it's going on. So I got that little pregnant pause like, that's a long time now. Okay. So there's this wonderful program with lots of data, lots of numbers that talk about that the increased ability to retain a present moment focus, to act with awareness, is an effective complementary therapy for a wide variety of medical and psychological conditions. So the studies have shown that the mindfulness-based practices in the MBSR therapy can help reduce fatigue, pain, addiction, and may also have the ability to strengthen a person's immune system. Okay, well, he has this wonderful program, but it's not super helpful for Parkinson's. And that's because of the time and energy and effort that needs to go into it. So wonderful. We've got somebody named Timio Marcel Bookwitz in 2020. Now he's putting together, or she, is putting together a main goal to develop a program specifically using that MBSR program with new ways, like new changes to support Parkinson's, for the insight into Parkinson's disease symptoms by using mindfulness. It calls it a PD-specific intervention for increasing patients' mindfulness and thereby reducing impaired self-awareness for motor symptoms. Okay, so this study has the conclusion, right, which is that by increasing the self-awareness of motor and cognitive symptoms and also increasing the patient's quality of life on many levels. I like this because now people are thinking specifically about Parkinson's disease and how mindfulness and that time tested true MBSR program can be reformatted in a way to help Parkinson's people. Okay, and then I wanted to say that this research is going on, and there's another one to be completed in November of 2024, and this one is basically an MBSR for Parkinson's disease. And then my last note on this is that many of the stress reducing techniques that help manage that help manage stress-induced dysregulation of the brain axis, also help with that anxiety and depression. So again, that there is this connection between our brains and our bodies, and that they talk to each other. So that's what they're talking about with that brain-gut axis. Okay, now this is basically a summation list of how yoga can help and what are the benefits of practice, right? So the general benefits are yoga's for everybody. You're breathing, we can do yoga. It's readily adapted to a chair. Yoga is safe and beneficial complementary therapy for PD. It's a physical exercise, and physical exercise has been proven as a way to manage and slow the progression of the disease. It's cost effective. It can be done at home, right? You can do it on Zoom. It's safe, and it also fosters a community in a group class. I did want to give a little plug for our PEP for You program. It's even if you cannot come to a live class or a live Zoom class, there is a plethora of videos where you can take yoga videos or boxing videos or agility and coordination videos. There's so much resource in our PEP for You exercise program. Okay, physical benefits. So we've been talking about this, which is, the muscle flexibility, so reduces tension and rigidity in the muscles. Yoga helps with building strength and endurance. It increases the joint mobility, right? And when you have mobility, it's pain reduction, right? So you have an increased range of motion. Coordination, agility, improves walking gait. Balance, so it's postural stability and proprioception, which is knowing where our bodies are in space. And when we know where our bodies are in space, it reduces that fear component that is part of that Parkinson's, right? So it reduces that fear of falling by knowing where our bodies are in space. And yoga as also, improves posture. So when your posture is improved, so like go back to those original slides where it's postural instability, where you maybe slump forward or maybe over to one side or the other. It helps practice improving your posture. Why? Because it reduces the risk of falling. Okay, so we know it. This is the reduces the low back pain, the cardiovascular health, with dynamic moving, digestive health, brain and nervous system health, and sleep better. Okay, so now we're moving into the mental, emotional benefits. Yoga practice mindfully has a relaxing effect on the body and mind. It helps reduce the stress response in the nervous system. Okay, so that regulating the mood, improves confidence and self-efficacy, reduces the fear of falling. It's a stress reduction by increasing the parasympathetic activity of the nervous system, or vagal toning. Yogic philosophy is a healthy lifestyle, quality of life, cultivating equanimity or a sense of, being peaceful where you're at right now. Mindfulness is a present moment experiencing. When we're in the present moment, we're not ruminating in the past or obsessing or catastrophizing about the future. And what I do love about the awareness practices is it moves us into those upper cortexes of the brain, right? So we do know that with Parkinson's, if we can stay in those awareness practices, those upper cortexes, we can make decisions that with walking gait and with those automatic systems may not be accessed like they were before, but if we can get into those upper cortexes of the brain, it increases our quality of life. Okay, so the energy benefits with yoga, that increased regulation of the autonomic nervous system, it means that we can move a little more freely, right? So the stress in life is going to keep coming. If we learn to practice mindfully, we can make decisions, right? So that place of being able to regulate out of that stressful place and bring ourselves back into a place of ease and peace. It reduces the sense of fatigue, apathy, and increases motivation, right? Some of these things that are related to the brain changes, we can use yoga practices to help bring ourselves back into a place where we want to participate in our lives again. Stress reduction awareness, manage energy resource. Okay, so when we start to practice that mindful yoga practice mindfully, it's the practice of being able to manage your energy, right? Working with yourself where you are and then going from there. So here is the yoga as a healthy lifestyle. So to me, it's yoga is a lifestyle to support that lifelong commitment to exercise. So that's self-efficacy, self-empowerment. Parkinson's is a progressive disease, and you can still do yoga even if it's visualization, breathing at the towards the later stages of Parkinson's. It goes with you. It won't abandon you, right? So this place of self-efficacy and self-empowerment for our lives. Yoga is for everybody, and the practice will meet you where you are, and it creates a sense of connection, well-being in life. Okay, right. So you can see here that I have a, fierce love of yoga. So I'm going to put together a yoga class for you, but I would like you to, the objective, right? So there are 8 limbs of yoga. So asana is the posture, pranayama is the breathing, pratyahara is the senses, dharana, dhyana is and samadhi refer to the meditative visualization, concentration, sense of well-being. And then on the lower left limbs are the niyamas and yamas. And those are the yogic philosophies that are built into how I practice or facilitate yoga in everybody's class, right? So that's not special to Parkinson's. That is yoga. Okay, so my objective for these yoga classes for Parkinson's are a mindful yoga class that's designed to create a safe, welcoming community, reduce the stress response, relieve tension, increase joint mobility, reduce muscle rigidity in specific areas of the body, create strength, balance, and increase an overall sense of well-being. So we do the small pieces and we do the big pieces to really just feel better in our skin every day. Okay, so let's see. The last of it is I left my contact information there. So if you ever want this presentation comes across your desk and you ever want to reach out to me, this is how you find me. And thank you so much for spending some time with me with Parkinson's. I'm going to get ready to put together a yoga class for you. So in preparation, maybe have a chair, a clear workspace, and I'll see you soon. Thanks for spending some time with me. Okay, I'll see you in a bit.